From the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
Welcome to today's program. Our topic today is prevention, education, and treatment of HIV and AIDS cases. I would like to welcome to our program, in order to discuss this very serious topic, Mr. Keith Walter, who is the coordinator of the North Idaho AIDS Coalition. Our guest holds a baccalaureate degree from Concordia Lutheran College in Ann Arbor, Michigan. He also is a graduate of the Trinity Lutheran Seminary in Columbus, Ohio, and in addition to that, he holds a master's degree from Gonzaga University. Keith, welcome to our program. We appreciate your time and discuss an important issue. As always, I'm so pleased to have our regular two panelists. First of all is Janelle Burke, who's an attorney in the state of Idaho, and next to her is Steve Schenck, who is the Vice President of College Relations and Development at North Idaho College, and we will invite Janelle to commence today's questioning of our guest.
Well, it's a pleasure to have you here on our program. Can you tell us exactly what the North Idaho Coalition is made up of? What is that organization comprised of?
Well, in terms of employees, I'm there in composition. We also have a huge number of volunteers. It ranges from anywhere from 15 to 30 folks. That's pretty good. We are, as North Idaho AIDS Coalition, our purpose is really twofold: to provide care for people who are HIV positive or living with AIDS, and to provide care and support also for their family, their friends, their loved ones. And that care can take any number of forms, whether it's emotional or psychological or social or financial sometimes even. The second part of North Idaho AIDS Coalition's mission is to do prevention outreach and provide education, not just information, but also a more emotional education or prevention resources for folks, so that those of us who are HIV negative, that is, don't have HIV or AIDS, can remain negative.
Now, when you're talking about North Idaho, what area are you encompassing?
My responsibilities cover the 5 northern counties of Idaho, so there's a bit of traveling involved, lots of telephoning too, from about Plummer north to the border.
I know that a lot of our viewing audience is from other places, and they'll find the information that we have to offer today very good, and they will be interested in what you have to say. The next question that I have has to do with exactly what are some of the varieties of AIDS. What are we talking about when we talk about HIV positive, HIV negative? And are there those folks who actively have AIDS, in other words, are suffering from the disease, and those who it is in a remission stage?
Oh, well, I don't know if remission's not a word that's used yet with AIDS. Maybe someday that's one of the hopes. But when we're talking about AIDS, what we're really talking about is the human immunodeficiency virus, HIV. That's the virus that causes AIDS. Most people who have HIV are, to all apparent purposes, in good health. There are no symptoms. They look fine. There are about 4 stages of HIV disease, with AIDS being the end stage, just immediately preceding death. And the first stage is when someone's newly infected, and what they may end up with are flu-like symptoms for a few days, a few weeks. Those go away, and then you're asymptomatic in the second stage, and that can last for up to 10 or 15 years. You may not know, once you've had this bout of the flu, you may not know that you have HIV. And then you begin in the third stage to have minor health issues that are sometimes a little odd. They don't seem quite right, because they're opportunistic infections that those of us who don't have compromised immune systems fight off readily. But they start having problems with those if they're HIV positive. And then the fourth stage is AIDS itself, when you have the full-blown acquired immune deficiency syndrome. And that's diagnosed when you have an opportunistic infection full-blown, or when your T-cell count, the T-cells fight the immune system, when they drop below 200 or 14%. We're talking now with the new drugs the last 4 years of maybe having another stage 2 in AIDS where people are getting better, their T cell counts go back up, and they're able to function a lot better and have a higher quality of life. So those are the different categories of HIV and AIDS where we're at right now.
Just one final question before we go to Steve, and that's about how many people are you serving right now?
My client base is about 30 folks here in North Idaho, and we know there are about 60 who have tested positive. I don't get names automatically. People have to come to me as a referral. And so I know about half of them that I work with. And we estimate that for every person we know of in North Idaho, there are 4 people we don't know about that are HIV positive or have AIDS. And they're walking around perhaps not knowing it themselves. That puts it about 300, 350 people in North Idaho.
Steve Sheen.
Keith, you mentioned that remission is not a term that can appropriately be applied to AIDS yet. It's still then a terminal disease. No cure.
There's no cure
permanent,
yet.
A way to stay. Well, obviously, there's no permanence in life.
No, there's no permanence in life. One of the things a person with HIV or AIDS can say now is they have a better idea what they might die of than those of us who don't. But because of some of the medications and treatments, they might just live long enough to step in front of the proverbial bus by accident and get hit by it first.
Well, let's talk about the high-profile case that comes to my mind is Magic Johnson, who has been an announced HIV positive sufferer for a long time, appears to be healthy, and he seems to fit the profile you described earlier. Viewers and the general public, I take it then, should not look at him and say, well, gosh, this isn't all that serious a disease, should they?
No, it's still serious. If you have HIV or AIDS and you are working actively to treat yourself with your healthcare providers, you're taking perhaps 25 or 30, 35 drugs a day. And that's a challenge, not only to your finances, but also just psychologically being able to take that many pills. I know one young man who goes to see a psychiatrist twice a week just so he can take his pills. It's that hard. The term is called adherence, trying to adhere to a regimen. Some of the pills are the size of horse tranquilizers. You have to chew them and they taste like chalk. I take vitamins in the morning, and some days that's just enough to take 2 of them. So this is the tough part. Plus, it costs anywhere on average from $800 to $1,200 a month for your AIDS drugs themselves. And any other drugs you need to fight opportunistic infections or anything else you have, the bill just gets higher.
A quick statistical question. What's the status of the disease in North Idaho, in Idaho, and in the United States, if you have those statistics? How many people infected?
People infected in Idaho are around 600. And in North Idaho, again, we're estimating, well, we know of about 60, 65. And in the United States, I can't remember what that number is right now.
And has the rate of new infections, is it slowed? Is it increasing? Held about steady? Well,
that's the concern. It seems to be going up and increasing amongst all categories of people at risk. One of the great things about the drugs is that people are living longer and feeling better, but there's a certain, relaxation of anxiety about the whole thing. And we don't want that to happen because you have a whole new set of problems if you're HIV positive that you don't need to have. It's too much of a challenge.
Thank you.
Another area, Keith, we want to get into is oftentimes there's a misconception that who can contract this particular problem or become HIV positive and maybe later to AIDS. You have some numbers and statistics, I know, for North Idaho, and you may have some for the whole state. Would you share with our viewers to enlighten them that it's not a disease that's confined to any one group or community?
Generally speaking, what we say that we make a negative statement, AIDS is not a gay disease. AIDS has to do with the virus and it can infect anyone. In North Idaho, the latest numbers that I have for my clients, about 49% are what you would call men who have sex with men. A lot of those men don't identify as homosexual, much more gay, so we say men who have sex with men. And there's about 37% who acquired HIV through heterosexual contact. And then the difference is about 15% who aren't sure how they got it. Injection drug users are also a big category in the state of Idaho. I don't have a lot of injection drug users who are clients. That in itself might reveal a dynamic if you are an injection drug user. You're not going to maybe come and talk to somebody or reach out for help quite the same way.
From the numbers you have given, are those comparable with national numbers, or is Idaho somewhat different in the different categories and how many people acquire HIV positive from the different groups that you've identified?
Well, these are the target groups nationally too.
Mm-hmm. But I mean, are the percentages pretty much the same?
No, I think the heterosexual component's a little larger here in North Idaho
than it is nationally.
And that's one of the shockers is if a heterosexual person comes down with AIDS in North Idaho, it's usually when you have full-blown AIDS, because they just don't think, well, it doesn't happen to me and it doesn't happen in North Idaho, and wham, there
or it
they
doesn't
are.
happen to heterosexual people.
Right. Mm-hmm. And there's the shock. And they find out not when they're HIV positive, but when they have full-blown AIDS and a whole host of opportunistic infections.
Janelle Burke.
I want to visit with you a little bit about some of the issues that affect women. Mm-hmm. Sometimes we think of AIDS as being more a men's disease than a women's disease. Is that true?
No. The third highest category of folks here in North Idaho are women with high-risk partners. High risk meaning a husband or live-in boyfriend who is also sexually active with other men, or an injection drug user, and gets HIV either from high-risk behaviors with other men or from sharing dirty needles through drug usage. He then goes home and through heterosexual contact with his wife or partner gives her HIV.
What are some of the problems that are peculiar to women? I would assume that pregnancy then might be a problem.
Pregnancy is a real issue because if you are an HIV positive woman and you are pregnant, you can give HIV to your child either in utero or in the birth canal or through breastfeeding. And I know some stories of some women who found out when they were still breastfeeding their children. They had to stop immediately. And then their children were tested regularly. Luckily, none of them that I know came down with HIV. But that was really a scary moment for the mother. She not only had to cope with her own condition, but with the condition for her children as well.
What are some of the words of advice that you would have for women who have high-risk partners?
Talk to someone. Go talk to somebody. Break the silence. If you have any concerns that you may be exposing yourself to HIV, find out. You can call me at North Idaho AIDS Coalition. It's a confidential phone number. I'm the only one with access to it. If you want to talk to a woman, as a woman, you can call me and I can give you the names of professional women who would be happy to talk to you about high-risk behaviors and your fears and concerns.
What is that number?
762-8197.
I'm going to represent some people need to get a pen and pad, Janelle, and also some people may be outside our state that want to call. They don't have other access, and so we're going to do that again. And then I'll go back to you once you finish. Again, I would remind the viewers, though, that if they're out of our area, it's an area code 208. And then the number is 762-8197. And if I don't forget in the show, I will bring it again. Thanks, Janelle.
I'll pass to Steve.
Well, since we've already got Tony engaged in the conversation, and since I learned before the show started when we were visiting that you're both political science majors, at least you were as an undergraduate
It was
student.
a long time ago, yeah.
Aren't there some legal implications to people who know that they are HIV positive or have AIDS if they continue to have unprotected sex? Isn't that illegal? I mean, aren't they, in a sense, threatening the lives and healths of their partners?
Yeah, I'm not I'm not sure how exactly. I'm pretty new in the Idaho field here, just a few months, and the legal question, you're the first one who's asked me that. We have a partner notification as part of our counseling and testing and referral program, and the goal is to be able to test everyone and include in that testing process the counseling, referral, and partner notification. When it comes to the law and somebody willfully attempting to spread HIV, I think there's some legal implications there. But
I can add a footnote there.
Okay.
There's two or three things. One is, and what Keith is talking about, there have been some cases in the United States, not here in Idaho, but where someone who had HIV positive, it was even testimony that says they intentionally tried to spread the disease, and they've been criminally prosecuted. And I believe there's also some other cases where, even though it was not intentional, but they knew they had AIDS and or had HIV positive status, and they too were brought into court. So there are cases of examples.
Yeah, I don't remember any examples from Idaho, but I know there have been other ones out there.
Of course, the ultimate goal, we've established that AIDS still is a horrible, life-threatening disease. The real goal is to prevent ever contacting it. Can you talk to us a little bit about prevention? Is that a part of what you do?
Right, that's the second part. Providing care for people with HIV or AIDS and their families and loved ones is the first part of the mission, and it takes about half my time, and the other half is involved in prevention outreach. And at North Idaho AIDS Coalition, we carry contracts through the state from the Centers for Disease Control to do prevention outreach. There are the three target populations: men who have sex with men, injection drug users, and women with high-risk partners. That is mandated as our three target populations. And so we're trying to devise strategies that are effective, that are feasible, and that have a good level of support in Idaho to reach out to those three target populations. And one of the interesting things, that doesn't exactly include high school students who are very vulnerable but not yet deeply impacted. However, we spend a lot of time talking in high schools. There are other monies available that we've been able to utilize. So we're trying to reach out to those three populations in different ways.
It was high school students I was going to ask about next. What is the reaction that you get when you talk in high schools? Do young people feel that it's a disease that can't touch them?
Kids in high school, and in other past lives, you might say, in past careers, I've worked a lot with youth, and they pretty much think of themselves as immortal and invulnerable. There's just no getting over that. One of the best ways I found to get to kids was to tell stories. In all, just whatever the point you need to make, tell a story. So one of the things we do is actually try and have an HIV positive speaker go into a high school or middle school and tell his or her story. And then you get them. And so you have to engage the kids where they're at and get them thinking that way. And really come at them 10 different ways if you can. It's tough.
There are a lot of people, and this is an issue I think in public schools whenever we're dealing with the young population, who feel that the message that ought to be delivered to our young people is abstinence. Let's not talk about condoms or safe sex or things like that. That the abstinence is the right message we should be giving, and the only alternative we should be teaching to young people. How do you react to that?
Abstinence only is what a lot of the schools teach, and if the schools say that's what our school district does, that's what we work with. We'll work with people who say abstinence-based, which I think is probably a little more closely grounded in reality. That's probably where the debate starts, and I certainly respect those who disagree with me. But kids are sexually active, and we need to be aware of that. There are numbers that say there's lots of them. There's not lots of them. Who knows? The point is, if abstinence is the best method, and I think it is, until you're emotionally and psychologically and mentally, financially prepared to be sexually active, you shouldn't be. And I don't think anybody in high school fits in that category. Mm-hmm. But if kids are going to be sexually active, I think the important thing is to make sure that they know how to protect themselves and any partners that they might have.
Thank you.
It's a judgment call.
And a tough issue for you, I bet.
Yeah, makes me sweat.
I want to deal with prevention, and on this program, we're very fortunate to have someone who's professional and knows how to do that in good taste and so forth. But if we could just save the life of one person from this program, it would certainly make the existence over the years very justified.
Mm-hmm.
Would you take a little time to say to people who may be at risk, you obviously personally can't control everybody's behavior, but you sure can inform them of some things that will increase the chances of preventing HIV positive status. So would you take some time to say, particularly to people who are reaching the age of adulthood and are likely to be sexually active, even maybe before marriage, what they should not do and what they should avoid, and how they should be very sensitive of a partner?
Well, the word condom immediately comes to mind. If you're going to be sexually active, you don't want to be exchanging bodily fluids, especially semen or vaginal fluid or blood. Those, along with breast milk, are the four
that really increases
fluids.
the chance of contracting HIV.
Right. And what happens is when HIV, through one of those four fluids, gets into your own bloodstream, then you have a high chance of becoming HIV positive. Condoms, latex barriers of some sort, if you're sexually active, are really the best prevention method. Now, technique alone doesn't work. You have to also be emotionally prepared to deal with high-risk behaviors and be willing emotionally and willfully commit yourself to having safer sexual practices. And so we can talk about information, how to use condoms, what sort of sexual behaviors are higher risk and which are lower risk. But you also need to be able to talk with folks that you trust and know, and that you can let them into your life on that emotional level so that you can overcome barriers that are also going to keep you from practicing.
Isn't it also a significant factor, and I've read this in some reports, that particularly some young people, even though they may practice what we call safe sex, but occasionally they won't, and they think if they just one time violate that rule, that's no great risk, and it only takes one time of unsafe sex to wind up in that tragedy.
If you are practicing sexual behaviors that are high risk or unsafe, and there's guilt and shame about it often, you need to know it's okay, and I'm telling you now, it's okay to stop practicing unsafe sex and to start practicing safer sexual behaviors. It's okay. You don't have to wallow in guilt and shame or be overcome by that. It's okay to talk to somebody about that who's not going to judge you or further shame you. It's okay to do that and change your behaviors.
One more question on prevention.
Sure.
Then we'll go to Janelle. Also, there is an increased risk of not only this particular problem of HIV, but other sexual diseases if one has multi-partners. Mm-hmm. Is that correct? So that's another factor that people should be aware of.
If I can add and elaborate a little bit on that, statistically we know that people who have multiple sexual partners are at higher risk for HIV. Not because they're being promiscuous, and that's a pretty emotionally and value-laden word, but statistically it's true. If you have multiple sexual partners, you tend to have higher risk behaviors and get HIV. So that's important to acknowledge and understand. And then also we need to talk about alcohol, especially with kids, but also with adults. Huge incidents of infection are recorded when somebody was drinking, and when they were drinking and under the influence of alcohol or other drugs had unsafe sex. Okay. So if you're going to drink, don't have sex.
Janelle Berg.
If some one of us should know someone who has AIDS, or who is diagnosed as being HIV positive or has AIDS, what would you suggest that our response be or our reaction be? How do we react to the person who's just found out, or maybe someone who's really sick?
If you haven't met too many people who are HIV positive or who have AIDS, what I notice is that then you, and I'm saying I don't know if you do or not, Janelle, but there's
most of
usually a
us-
sense of heartbrokenness and sorrow. And like with cancer years ago, oh no, I'm talking to a dead person, and there's that grief thing and there's a sense of horror. It's important to deal with your own feelings first, and then see that person who's HIV positive or has AIDS as just another human being who has a pretty serious virus, but is also still a human being, and who's probably feeling overwhelmed, isolated, cut off. You don't have to worry about eating, off their plates. You don't have to worry about mosquitoes in the vicinity. You don't have to worry about touching or hugging them. If there's somebody really close, you can give them a kiss. It's okay. Saliva is not one of those 4 fluids I mentioned. You can't get HIV from kissing someone. So it's important to touch in appropriate ways, to affirm that person in any way possible, but without being condescending. It's important also to just treat them as your peer and your friend as always.
Steve Shink, about 2 minutes.
We don't have a lot of time left,
Okay.
but obviously what we're trying to do is something positive here, inform people, educate them. Almost always when people see something like this, so there are going to be some folks who are frightened and wonder, oh my gosh, do I have AIDS? And are going to want to rush right out and do what? I mean, should they be tested? Did you discourage that? Is there a quick, inexpensive way people can tell whether they may have already contracted the disease?
Sure. If you want to be tested and you have some concerns, call the public health nurse. And they're excellent public health nurses in North Idaho, in all of the cities. The one in Coeur d'Alene I work with the most, she's wonderful. And you can call her.
Or another state, your public health office.
Call your if you're not in North Idaho, sorry, I forget that. If you're not in North Idaho, call your public health office. There's a confidentiality there.
On that note, we have to bring the program to conclusion. I will give the telephone number one more time for those who would like to contact our guests on this subject. It's area code 208-762-8197. Ladies and gentlemen, we've tried so hard on this program to inform you of a very important issue, and we hope that it has been informative for you, and we believe it has. And I would like to invite you to be with us again next week. We'll be moving from this subject to yet another subject of importance. We do very much appreciate the opportunity to come into your home or your businesses with what we believe to be important issues for our times. And we appreciate your contacts with us and information from you. I would like to invite you then to be with us again next week at the same time. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Instructional Technology on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.